Hello, everyone, and welcome to July's Ask the Expert session. We've picked in there right at the end of the month to make sure we brought you one in July. You're probably used to seeing Paula, our Chief Executive. She's on a bit of leave at the moment, so I thought I'd step in and do this. My name's Mark. I am the Administration Manager, and today our Ask the Expert is with Loren, who is our new helpline nurse alongside her other job. I will give you a brief intro, but I'll let her do the majority of talking. But Loren is I'm going to get this right, Hepatology Clinical Nurse Specialist, I believe is the full title. Is that correct?
Yeah.
Excellent. Do you want to give a sort of brief introduction to yourself and your history?
Yeah, so I have been working at the John Radcliffe Hospital in Oxford within hepatology since 2013. I had a brief year break in 2016 where I worked in A&E, and then I came to specialise within hepatology. So I've been working here now for the last 8 years. Currently doing my master's degree, so I will be an advanced clinical practitioner hopefully next year if everything goes okay.
I'm sure it will.
Fingers crossed. I'm just in the middle of my dissertation, so we'll see how that goes. And I suppose the other thing to point out is I'm also a PSC patient, so I'm in a weird position where I sort of see it from both points of view, if that makes sense. And yeah, that's about it really for me.
I think that duality of being both a patient and having the clinical knowledge as well might put you in a fairly unique position across the UK, or if not unique, I mean you must be one of few people who has that both worlds of knowledge. So I think that's a wonderful thing, you being to our helpline. And so you work with us to answer any emails that come in, or the helpline call feature that we have on our website where people can book slots to have a chat with you.
Yeah, I do that. Yeah, it's mostly in the evenings, because like Mark said, I have to do it alongside my other job, which is a full-time job within the NHS. So I have to do it mostly in the evenings. We are hoping to do Zoom calls through the helpline, because obviously if you've been newly diagnosed or you're ringing on behalf of a relative, it might be nice to have someone there for sort of some support. And also, if you're being told quite a lot of information, sometimes you can forget that information a bit later on, and it's just nice to have another person there with you. So that is something that may be coming very soon as well.
I think that's good. I used to take my husband along with me to my appointments and drag him inside with the express sort of instruction. He wasn't allowed to talk. What his role was to remember the things that I would then forget.
Yeah, I think that's very, very common, is that people will drag, mums, dads, partners, brothers, sisters, whoever in. I mean, I'm quite lucky. If I forget something, I work really closely. I can just grab her and ask her in the corridor. So I'm
not something that's available to everyone, unfortunately.
Unfortunately not. Yeah, don't start hanging around hospitals hoping to grab your consultant, because that doesn't look good.
So I did a bit of an analysis when people finish with a helpline. A little questionnaire goes out and people can choose to fill it in or not, and on that you can fill in various forms. And I've done a little bit of analysis, and I've come up with a top list of why people contact our helpline and what is sort of talked about. And so what I think I'm going to do today, Loren, is sort of pose some generalized questions to you in the hopes that you can sort of give it an example of the information and support that you would, and then that will hopefully inform the people who are watching. And if they've got any further questions on those particular areas, then we can field them as well. So if we start with the number one thing that people want to talk about is the prognosis of the disease. So people phoning up asking, does everyone with PSC tend to follow the same disease journey from beginning to end?
The short answer is no. Everyone is different. Unfortunately, there's no sort of proven ways we can predict who will need transplants, who may be more susceptible to cholangitis. there's no sort of way we can predict it, unfortunately. So everyone is different. The I know we're going to talk about this a bit later, but the monitoring and procedures that every PSC patient has is all the same, but the journey can vary off at different angles at different points, whether it be, you know, when you're first diagnosed, to, you know, a cholangitis attack, or if you've got IBD as well, that can change the journey. But the short answer is no, unfortunately. So if you were to hear about someone's journey that may be particularly hard, or quite they've been really unwell, it's hard to think about, but it's not necessarily going to be the same for you. And I suppose also if someone's had a very easy sail through journey, it unfortunately it might not be the same for you. But yeah, every journey is different. And you know, clinically that keeps us on our toes, I think.
Makes the disease, I think a word that's used quite a lot by doctors and nurses is interesting. It makes it interesting, which, yeah. And does that apply the same for symptoms then? So another topic that we get asked about is the symptoms, and does everyone experience the same symptoms, and do they experience those symptoms at the same time within there? So is it, I guess another way of phrasing that, is a specific symptom an indicator of how far along the disease progression you may be or not?
No, so the most common symptoms are fatigue, itch, and what we call right upper quadrant pain, which is sort of, if you imagine your abdomen square and then split it into four, and then the right upper quadrant is where your liver is. Not necessarily, you might not necessarily have all of the three symptoms, you might only have one or two. They can come and go. There is also no correlation to how severe one or more of your symptoms is to the severity of your disease. So we see lots of people who suffer really, really badly with itch, but their blood results, their MRCPs and everything else are, you know, within normal ranges. You might find that, I suppose, some people may notice some symptoms maybe before they're diagnosed. They might have like an ongoing fatigue that's been there for ages, and it probably gets passed off as, you know, other things, because a lot of things can cause fatigue. I suppose if you have IBD, then the diagnosis can sometimes come a little bit quicker because they're linked. But then some patients will have no symptoms and be absolutely fine, but their bloods might be quite high and elevated. The other symptom I would also look out for, and no offense to doctors, but I don't think they're very good at looking at mental health symptoms. So obviously having a rare disease like PSC is, you know, quite an anxious, it can make you quite anxious and worried about the future, but also the severity of your symptoms can be very, very debilitating and can have quite a negative impact on your mental health. So don't, if you know you feel that your mental health, you're struggling with it, don't be scared to say to your consultant, your GP, that you are struggling with it, because it's a very common symptom. But I just don't think as clinicians we sometimes look into that as much as we should. And
I think there's still a sort of stigma around mental health in general, but also around dealing with it personally. I know in my PSC journey, I found that the mental health side of it was something I just never talked about with the clinicians, because I felt that was my struggle, and I now realize that was definitely the wrong way to go about that.
And I think that's the thing, because when you're diagnosed, you know, some people may feel like it's a burden on their relatives, their friends, family, and so they think, well, I need to keep it to myself because I don't want to be any more of a burden on them if they think that, you know, mentally I'm not doing great as well as physically. But it's normal. And PSC is a lifelong disease, and therefore it is going to affect you. It might not hit you at first, but it will come and go. And I think that needs to be recognized more with patients. And I think that yeah, patients shouldn't be scared to say to doctor, specialist nurse, I don't feel mentally well, because it's okay. If you've had PSC for years and years and years, and suddenly you're being assessed for transplants and things like that, and things are progressing, but you feel well physically, that can also then be worrying, and have a massive effect on your mental health, because in your head you think, but I feel fine, I don't have any pain, I'm not necessarily fatigued, I'm not necessarily itchy. But then you've got loads of doctors saying your bloods are awful, we need to send you to a transplant center and you can have a transplant, and it can just feel like a train's hit you, I think. And
is the best person to talk about that with, is it best to go to your liver specialist, or is your GP a better avenue into that kind of support?
I think GPs probably, because I think they have more access to things, whereas I think if you go to your consultant or specialist nurse at a hospital, the psychiatry sort of what's it called, the psychiatry service is so overwhelmed. And I mean, it probably is in the community as well, but I think within the community, patients have the chance and choice to refer themselves. So sometimes you don't even need to go to your GP. You can refer yourself for counselling or cognitive behavioural therapy. And I think that differs from place to place. I know in Oxfordshire, we have something called Talking Space. And you can basically go on their website, put any details, and you've referred yourself.
There's a self-referral process and that, I suppose, in a way would avoid the issue that I had of having to sort of open myself up to a doctor who's trying to talk about my liver, even though it is all connected.
Yeah, definitely. And I think, yeah, you then don't have to. I think some patients feel like they're not wasting time, but they feel like the doctors don't have time to think of their sort of mental health within their physical health. And I do think it's something we definitely need to improve on.
Yes, yeah, I will make some notes for future activities for the charity to get into. Actually, mental health was one of the higher reasons people do contact our helpline. I think sometimes when before the helpline existed in PSC support history, there was a number you could call to speak to someone, even though it wasn't branded in the same way. And that's something I did when I was first diagnosed. And just reaching out to someone who understands, I think, is, well, to me at least, was incredibly beneficial at that time. So I'm glad that we've now got this new iteration of it as well, which is moving forward and developing.
Yeah, I think that it's good for people to have sort of people who understand what they're going through to talk to about things. The amount of times that I've said, oh, I'm really, really tired, I'm really fatigued, and people go, oh yeah, I'm really tired as well. And you just think, no, you're tired, you just need to go to bed early and you'll be fine. My bones and muscles physically ache today.
Yeah.
And it's just completely different. And I suppose it is just having that someone to talk to. The Facebook group is also a very good resource. The one thing I would mention is that it's a forum, so it's other patients' opinions, and going back to what we said earlier about journeys and them being the same and different. Just bear that in mind, I suppose, when posting things on Facebook and having answers given to you. But then that's what we're here for. You can email 24/7, and then if you start by emailing and actually we think it might be best to have a call rather than email. That is another thing we can do, or you can just book the call straight through the website, whichever's easiest for you. But I just think when it comes to mental health, just talk as much as you can, because
Yeah,
bottling it up is the easiest thing to do, but probably the worst for you in the long
I think I like to tell
Yeah.
people that I've got my box system in my head where if I don't want to think about something, I stuff it inside a box in my head and close the lid. And that works great until there's too much stuff in the box and it all kind of explodes outwards all over my mind. And yeah, that's definitely. And I think you're right that it is worth reiterating that we have the helpline calls where we're looking at helpline Zoom calls as well. So there's a visual element, but we do answer emails as well. So if your preferred communication method is written, that's not a problem.
Yeah. And there are sort of other external charities like Samaritans, Childline, if you're under the age of, is it, I think 18 or 16.
I think it might even be a little bit older than.
Is it?
Oh, yeah, it's around that age. Sorry, I'm getting confused between the different helplines now.
What age it is, but they are there 24/7. If you are feeling particularly low, suicidal, they are there. And use them. Don't be scared to talk. It's okay not to be okay. I know that saying gets thrown around quite a lot, but it's okay to go through those feelings. It's okay to think, oh God, this is awful. It's, my life is ending. Sometimes just talking things through with someone, even when you feel like at your lowest point, even just sharing your thoughts and just bouncing them off someone can really, really help.
I agree. As someone's pointed out in the question and answer we have, that our next Ask the Expert webinar, which is on the 19th of August, is by a wonderful doctor called Dr. Gorvin. It's on managing the psychological impact of PSC. So we've got a kind of a focus on that at the moment, I guess, and you're quite right. It's I think an important focus. So that is there to sign up to if people want to sign up to that, or it will be recorded and put on to YouTube like we usually do.
And I was going to say, and I'm not mental health trained, so doctor will know more than I will.
Excellent. It is worth, so in my analysis of why people contact us, I think it was the 6th highest reason was people contacting us because they have a friend or a relative who's got PSC and wanting to know what they could do to support the person with PSC. And I think that's very good in highlighting that while you may feel alone, other people in your life may already be reaching out to see how they can help you. So that support networks do exist. I know it can feel lonely.
Yeah. And I suppose those people might not feel comfortable to talk to you about it because they're worried it may upset you, or you might not want to talk about them. So they might do it sort of more behind closed doors. But I think it's comforting to know that, we do have a lot of calls from friends and family worrying about loved ones. And it's not just, mums and dads either worrying about more children. It is people worrying about adults. Which is lovely, really.
We're getting some great interaction through the Q&A. Someone has pointed out that many employers have confidential employee assistance programs that have counsellors. So through work, if you're still in work, you might have access to mental health services that way as well. Excellent. So we're kind of jumping around my list a bit. So forgive me for it's good. It's great. So procedures, if an area we get asked about a lot is the procedures in the widest sense of the term is what kind of tests should people expect to have in a PSC journey. Not all of them will, I guess, apply at all stages, but yeah, what kind of procedures are there?
So I would say standard diagnosis tests and procedures would include blood tests, and that will look at your liver function test mainly. We have a thing called a scan called MRCP, which is a actually, and I can't remember what it's called. Magnetic retrograde cholangiopancreat I can't think of the last word.
Pancreatography?
Yeah, it's something
Pancreatography?
like that, which is basically an MRI scan that focuses on your bile ducts that a normal MRI wouldn't pick up on. So you will have one of those when you're diagnosed. You will probably have something called a FibroScan, which works in a very similar way to an ultrasound. It is the hardest thing to explain because it sort of gives your liver like a little flick, I suppose. That's the only way I can describe it. Something like it's like a thud. I don't know what it is. And that basically sends a wave across your liver and back again, and that can calculate the stiffness of your liver or how much scarring. The other thing some people may have at diagnosis is a liver biopsy. That's normally if they are predicting that you either have small duct PSC, which doesn't show up on an MRCP, or if you have an autoimmune hepatitis overlap. We don't tend to do liver biopsies anymore for diagnosis for large duct PSC purely because they're really invasive and painful, to be honest.
We're definitely all for the non-invasive tests, I think, is the
and it's the same with an ERCP. So ERCPs used to be the gold standard for diagnosis. However, they are so rarely used now. We only tend to use them if people have got what's called strictures, which is where your bile ducts become narrow, and we can put stents in to widen them up and open them up. I don't think I've ever seen a patient diagnosed with that recently. Then the regular tests you'll have. So guidelines state, and I use that term, they state what you should have is bloods 6 monthly, an ultrasound yearly. However, if you are cirrhotic, it should be 6 monthly. An MRC.
What do you mean by cirrhotic? Sorry, do you have a definition of that?
If you have liver cirrhosis, so if you have if your liver is very hard and scarred, you will need to have one every 6 months. You will need to have an MRCP maybe 3 to 5 yearly. It varies from trust to trust.
Okay.
If you have IBD, so if you have Crohn's or ulcerative colitis, you will also need to have a colonoscopy every year. If you don't, if you don't have IBD, then it's normally 3 to 5 yearly. Again, it depends on trust to trust. You will have the FibroScan every year, a DEXA scan, which looks at your bone density to see if you have, risk of osteopenia or osteoporosis, which is weakening of your bones. That's normally 5 yearly. Again, if you have liver cirrhosis, you will have to have an endoscopy, which is a camera down that way, which basically just makes sure that everything's okay down there. And I think they're the only ones.
There's I was going to just add that there's a lot of these tests could be done more often if there's an indication that something might be changing as well. So yeah, these aren't, I guess they aren't strict deadlines. They're more, as you said, guidance.
Yeah, and unfortunately, because of the NHS being in the state that it's in, people are unfortunately having to wait longer between treatments. And funnily enough, this is what I'm doing my dissertation on.
I think you've got the papers on top of your microphone. Sorry, just.
Yeah, so I'm doing my dissertation on that. So to see why and what we can do to make it a bit more manageable.
That's good. You're solving the NHS as well as helping us. That's amazing.
Well, I'm telling it that it's doing it wrong. I'm not going to fix it. Thank you.
I have to say that the talking about the procedures, MRIs, even in my lifespan with the disease, have got so much better. I remember the MRI machines that I used to have to go into compared to the new one. So if anyone is at that early stage where you're worried about having to do something like an MRI, because I think it still has a bit of fear around it, then the machines are much bigger nowadays. They're much more open. It's
they have
I
definitely improved.
Yeah, I definitely, I mean, I always took the more recent times I went as an opportunity to lie down and just rest.
Yeah.
They're quite loud, but I mean, yeah, just close your eyes and you can have a little snooze maybe. Maybe that's taking it a bit far.
I mean, they should give you headphones, so sometimes you get to listen to a bit of music as well to help drown out the sound.
Never got music. Oh, I'm jealous. I need to come to Oxford next time.
Yeah.
And so the sort of last area we'll talk about, because we've been going about 25 minutes, of people why they contact us is we broadly kind of define it as work and benefit related. So what support is there out there for someone who is maybe having a particularly hard time with the disease? Do they go the universal credit route? Is there a disability allowance? And we'll leave the work stuff to the side for a moment and come back to that after we've asked this initial bit.
So universal credit, I think, is available to everyone. It is means tested, so it is tested against your salary, and that's available to everyone, whether you are classed as disabled, well-abled, anything. So that's always something to look into. The other one is PIP, and I can't remember what it stands for now off the top of my head.
Personal independence payments off the top of my head.
So, and that's split into two parts. One is like your activities of daily life, and then two is mobility. So unfortunately with PSC, some people do have other autoimmune diseases as well, that can affect either one of them or both of them. I don't think that one's means tested on your salary. I think you can still claim PIP if you are working, but you do they do ask you quite a lot of questions, and I think you have to get letters from consultants and everything. So that one's a little bit trickier. Thank you. There's also something called DLA, which is Disability Living Allowance. If you are under the age of 16, or you have a child that's under the age of 16, that's something that could help out. There's an employment and support allowance, which is another benefit. If you are over the age of pension age, there is an attendance allowance that you can apply for. The other thing that you could get, it doesn't help financially, is a radar key. And a radar key unlocks disabled toilets in public.
Oh, okay.
So they're all locked now, and you have to have a special key. I think you have to pay for it. I think it's about £5. Especially if you have IBD, they are a dream, because it means that when you go out and about, you don't have to worry about going to a toilet.
You're blowing my mind now.
This is really good. So that's another thing to look into. And also, I mean, we're not benefits experts, but if you do have, questions about what other benefits you may be eligible for, I would advise to go to Citizen Advice, because they can go through everything with you, and give you everything, tell you what you could be eligible for and what you can get.
That makes perfect sense. Thank you. Is there I guess, support, or is there any information you can provide about having the disease and work? I know I'm trying to find a way to phrase this question so it isn't so wide and open, but it is a big issue that people with PSC often face, is this disease is impacting my life, which is impacting my work life. Is there anything around that you can offer out?
I would say, if you have an occupational health department, contact them. I have here at my place of work, they've logged it basically, so you know, if you have X amount of time off sick for, you know, coming to appointments, for example, and having test procedures, that's always good to have on hand. If you have a good sort of HR department, it's tricky these days because most people work from home, so it's really hard to try and find people to talk to face to face. But I would look at HR policies and procedures and just see if there's any sort of support and advice that they can give you, because it will differ from employer to employer. You don't have to legally tell them.
Okay.
What, you know, you're ill, this is what it is. You don't have to tell them. If you don't want to, you don't have to disclose it. And I would also, if you are worried about taking time off for appointments and things, you can ask your consultant for a letter. Again, it doesn't have to say what you've got. It can just say, you know, you've needed these dates for appointments, tests, procedures. That's always another way, just so you can sort of cover your back and it doesn't look like you're taking too much time off sick. If you know,
There's an evidence trail for it.
Yeah.
I should point out that our HR trustee, Charlene Oak, did a RC Expert about 4 months ago now. So that's up on YouTube about PSC, the workplace, HR related issues. So that's well worth a watch as well.
Yeah. And I suppose this goes back to mental health again, is if you are struggling, you know, try and speak out. Don't force yourself to keep working and keep pushing on. Like most of us do, I think. Because
It's hard to take our own advice on these things.
It is, because again, you know, long term, it will affect you.
Excellent. I will. We're sort of done with my questions, so I'm just having a quick look through our Q&A panel. We won't be able to get through all of the questions. There's quite a lot here. Some of them are related to other areas, so they'll probably be addressed in other RC experts going forward. But let's go through. There's someone who is saying that their son has PSC and they're a mental health nurse and offering to send us some information. Yes, please do. hello@pscsupport.org.uk. If we can use it, we will. Or if not, it's just a wonderful contact for us to have. So that would be amazing. This is a good question. What are the symptoms to look out for in the context of a cholangitis attack, or I guess not just symptoms to look out for, but maybe exacerbation of current symptoms?
So increased itch, pain, increase in fatigue, lack of appetite are the sort of main ones you might get, and just generally feeling run down and unwell. If you notice that you are becoming jaundiced, so if you're having yellowing of your whites of your eyes, your skin, if you have fever, then they're the more sort of serious signs of a very severe attack.
Yeah.
If you have any of these symptoms or anything changes, anything that's new or worse for you personally, contact, you know, GP, consultant, specialist. You need to be seen and assessed. It's always better, and we always prefer as healthcare professionals to see someone and say, no, you're fine, and do the relevant tests and say, no, it's fine, it's nothing, than to, you know, for you to sit at home feeling unwell and become more and more unwell and end up, you know, as an inpatient in hospital for, you know, however long.
It's worth noticing that cholangitis attacks the severity can go all the way up to A&E visits as well. So it's definitely something to keep an eye on. The symptoms as well don't necessarily correlate with general infection symptoms, which is a bit of a pain, I believe.
Yeah, it is. And if you are presenting to A&E or you're seeing an out of hours doctor, alarm bells don't trigger in them as much as it would do a liver specialist. So on the website, I would have a look at getting what we call an alert card, which is about the same size as your credit debit card, but it folds out into a nice piece of paper, and it has all the symptoms to look out for. It's basically you can give it to a doctor who doesn't know you and say, I have PSC, please, look, I've got these symptoms. And it should then hopefully ring alarm bells in them to initiate treatment, because the quicker we can treat it, the easier it is. But they're a really, really good, handy. I think I've got some somewhere.
I was just frantic. People might think I'm frantically looking around my desk. I usually have one here as an example, and I think I ran into someone the other day, and I think I gave it to them. But they're credit card size, and they open up, and they've got all the information aimed at doctors and aimed at you.
Yep.
They're on our website to order. You can order them. They're free. We do suggest, well, we don't suggest, there's an option for you to enter a donation to cover postage, but that is completely up to you. You can put 0 there and it will still be sent out to you, but they're there as a free resource for you.
Yeah. And they are really, really handy, really handy. And they also have a good space on there to write down your consultant's name, contact number, specialist nurse if you have one as well, just so that if you're ever out and about and you don't have, an appointment letter with their number on, you've got that with you as well.
I'm going to do one more question. This one might be slightly outside of your field of expertise, so I don't know is a valid answer to this, but someone is saying that they have PSC and they're being referred on to a dietitian. And is there a better diet one can follow for PSC, or is the diet advice going to be more about targeting certain factors in your specific case, I guess?
There's no evidence to suggest that a certain diet is good for PSC. If you're seeing a dietitian, the good thing with dietitians is they will look at you as an individual and work out what you individually need. Obviously, we would try and sort of stay away from maybe fatty foods. Foods high in fat and fried foods can irritate your gallbladder and therefore irritate your liver a little bit as well. So we would probably recommend staying away from them. I suppose alcohol is the other thing. I mean, we can't say stop drinking, because we would say probably in moderation, but so that's 14 units a week for men and women. Can
you say what a unit is? That's always slightly puzzled me a little bit.
I think a unit is, trying to think now, I think like a
measure of
5 mils of spirits is about 1 unit.
Okay.
But maybe don't try and aim for 14 units.
Okay, it's not a target.
Yeah,
okay,
it's not a target to aim for every week. But you don't have to sort of live without eating and drinking what you like. Everything in moderation.
Which leads back to the mental health side of it as well. Is you don't need to stop living your life.
No, you don't. Definitely not. Obviously, if you're on the transplant list, please do not drink, because they will remove you from the list.
That's good to know. That's
good to know. Only thing I would say.
Thank you very much, and thank you to everyone who's asked questions. And sorry we haven't got around to them, but we do have limited time, and we do like to keep things in the specialism. So there are people asking questions about research. We will have another research asking expert coming up. The next asking expert, as I said earlier, is with Dr. Gorvin about the psychological impact of diseases. The title I just double checked: Managing the Psychological Impact of PSC. So you can sign up to that through our website, or if you can't make it, it will be on YouTube afterwards. So I just want to say thank you very much to Loren again for coming along and sharing your expertise with us.
Thank you very much for having me.
And you're getting some applause coming up the side. I love seeing that.
You. And I may speak to some of you if your questions weren't answered. You can always email. I've booked out some calls for the next couple of weeks, so if there's anything you want to discuss sort of on a one-to-one basis with me, then please feel free to book calls.
So that's you can book those calls on our website. It's pscsupport.org.uk/helpline. Will take you straight to the helpline page. There's a cool little select the dates. The dates that Loren's available are sort of listed there on a calendar, and you can select them and fill in your information.
And if the times don't fit with you, please email us, because there might be ways and means I can find a time to suit you that's a bit better.
We're just take away from your main job little by little until we can.
Well, no, I know.
Thank you.
And some evenings are the most busy for people. So if people can't do evenings, if they prefer, earlier on in the day or a weekend, I'm sure I can fit it in.
We'll do our best to help you guys. So thank you again very much. Thank you to everyone for watching. I'm going to end the meeting now, but you are all brilliant people.
Thank you.
Bye-bye.